Dr. Lamar has been a primary author and co-author in several peer-reviewed journals and has presented original research at professional meetings. Before joining Florida Cancer Specialists, Dr. Lamar was an assistant professor at the Comprehensive Cancer Center, Wake Forest Baptist Medical Center in Winston-Salem, North Carolina. She's also a co-founder of Three Black Docs, a podcast serving and educating the community. Dr. Lamar is passionate about patient education and healthcare advocacy. Dr. Lamar will provide a short presentation, and then after that, we'll begin the Q&A. Dr. Lamar, thank you so much for being here. We really appreciate it.
Thank you so much for having me. I can't tell you how excited I am to speak with you all today. Thank you so much to everyone out there in the web world who's sharing their time with me on a Friday. I know you have many other things to do, so thank you so much for your time. So I will do a very quick overview of breast cancer and COVID, and then after that, I can't wait to hear your questions, okay? So let me go ahead and share my screen, and let's see if we can do this quickly. All right, can everyone see my screen here? Perfect, all right. So really, what is COVID? And if, if we don't know what COVID is, you may have been living under a rock for the last several months, but that's okay. If you have been living under a rock, COVID-19 is a virus that was discovered in China in 2019. And in March, it was declared by the World Health Organization to be a pandemic. And since then, really, our lives have completely changed. So, you know, as of yesterday, actually, the number that I have up is incorrect. Yesterday, there were over 150,000 new cases of COVID diagnosed in the United States. And today, that number is even higher. Since it started in the United States, there have been more than 10 million people diagnosed with COVID-19. And this information was provided by Johns Hopkins. And so really, what about COVID and cancer risk? We know that people who are undergoing active cancer treatment have an increased risk of having severe COVID, so of having more COVID symptoms and increased risk of complications associated with COVID. There's also an increased risk of ICU admissions in people who are undergoing active treatment and who have COVID. What we know less about has to do with people who have a history of cancer that was several years ago. And this information is coming from the NIH COVID guideline. All right, and let's see if we can advance this slide. All right. And so really, I think what I'm going to do, I'm just going to, I think my computers have gotten themselves crossed. So I'm going to just stop my share screen. But when we talk about risk, what are some of the risk associated with cancer? So I believe my next slide was just talking about the risk associated with cancer. So the Texas Health Organization did a really good job of saying, you know, what are some of the risks? We know that things like going to your mailbox, there's a tiny chance of you developing COVID from doing things like that. Whereas if you are going to a bar or, you know, going to even a worship service where there are 500 or more worshipers, we know that's associated with a very, very high risk of developing COVID-19. And I think my computer may be freezing here. Let's see. Okay. And so some of the things that are happening now, we know that patients who have received chemotherapy within 3 months, those patients are at risk for developing COVID symptoms. Sometimes in breast cancer, there are different treatments. Not everyone is receiving chemotherapy. Some people are receiving what we call endocrine therapy. You may be taking a pill that decreases the level of estrogen. That's thought to have a less of a risk of developing severe COVID symptoms. There are some drugs that are pills that are called Cd46 inhibitors. You may know that as Ibrance or Verzenio. Sometimes we think that may pose an increased risk just because it can sometimes cause your white blood cell count to go lower. And so there are vaccines that are being developed, and I think we'll talk a little bit more about that. I had some more slides, but I'm having some technical difficulties with the slides. So what I'll do is I'll go ahead and end the presentation that I had earlier, and why don't we just go ahead and start going into some questions.
Okay, is there anything that we can help you with your slides?
No, it's okay. I think that there was.
They were working, yeah.
Yeah, they were working, and then I couldn't advance the slides anymore. So it's okay. We can just go ahead and go to some of the questions.
Okay. Otherwise, you can send them to Vicki, and we can put them up on our end.
Oh, sure. And maybe what we can do is I can have them put up at the end of the presentation.
Yeah, that's fine. Go ahead and email them to me, and I'll download them now.
Okay.
So we did have a few questions that had been submitted. In just that little introduction, you have answered a few of the questions, which basically was about the risk factor for patients undergoing treatment currently, as well as, what would happen if we're talking about 5 or 10 years post-treatment.
Right. So we think that the highest risk of developing, and what I mean by developing COVID, all of us are at risk for COVID. If you were walking the green earth, you are at risk for COVID. And so really, when I say risk, I'm talking about risk of having COVID complications, some of the things that we see about on the news. So if you have received chemotherapy within the last 3 months, then you are thought to have an increased risk. But having said that, let me quantify that a little bit more for you. We know that there's different kinds of risk with different cancer types. So people who have lung cancer and people who have types of blood cancers where their blood counts are very, very low are at the highest risk when it comes to developing severe COVID symptoms. Some patients, or even patients who may have cancer that has spread to the lungs, there's an increased risk. But for most patients with breast cancer, that risk of developing severe COVID complications is lower. But your physician still may change some components of the treatment plan just to try to negate that risk a little bit more. So some of the things that we are doing, you may get a shot. We call it a growth factor shot if you're getting chemotherapy. In some cases, we with some regimens, we may not have used a growth factor shot. And now, we may incorporate that into the treatment regimen. Some people have even changed how they give the chemo, the timing of the chemo, if there is a risk. And now, the COVID numbers are increasing. We are in another wave. So I think one of the differences between us earlier in 2020 and now in 2020 is that we just know more about the disease. Right. Fortunately, less people are dying from the disease because we know how to treat it. Having said that, we can't let our guard down. We still have to take precautions. And I know these precautions have been hammered into you. I think by the time we wake up in 2020, everyone will be dreaming of masks, right? You have to wear a mask. You have to really limit your social bubble. Okay. And I heard someone one time say, we all think that, I'm not in contact with that many people. But maybe if you do a check mark with all the people that you encounter sometimes, you are in more contact with people than maybe you realize, unless you're doing a really strict quarantine. So, you know, your healthcare providers are doing their very best to keep you safe. And one of the things that we are trying to do as a cancer community is to make sure that treatment does not get delayed. So please, please, please do not delay. Because what we've learned, and now there's data that shows that we think that some people have been negatively impacted because there have been delays in screening mammograms. So, and delays with other types of cancers, other types of screening. So do not delay your treatment because of COVID. Okay, I know that was a long answer.
No, it's a lot of great information. Thank you for that.
No problem.
You mentioned a growth factor shot. What exactly is a growth factor shot, and how does it help patients?
Great question. Okay, so I like to think of your bone marrow as a manufacturing plant. Okay, your bone marrow is the squishy inside part of your bones. So if you put your hands on your hips and where your thumb lies, that's actually, you know, kind of where there's a nice part of juicy bone marrow in that area. And so your bone marrow is the manufacturing plant of your white blood cells. Your red blood cells are your hemoglobin and your platelets. And so when your doctor does blood work, usually that's what they'll tell you about: your white blood cells, your hemoglobin, and your platelets. Now, if your platelets or your hemoglobin are very low, there are things that we can do to support it, right? We can give you a blood transfusion. We can give you a platelet transfusion. If your white blood cell count goes low, we can't give you a white blood cell transfusion. So what has been developed is basically something that it's a shot that is used to jumpstart the white blood cells in that manufacturing plant in your bone marrow. We call these, there are lots of different names, and now there are all kinds of what we call biosimilars of the product, but some of the most common is something called Neulasta or Neupogen. And so you will get this in the form of a patch that goes off about a day after you've had chemotherapy, or you may have to come back into the office 1 to 3 days after you've had chemotherapy and you'll get a shot. What this does is it helps to boost up your white blood cell count and shorten the time that your white blood cell count is low. The reason why this is so important is because your white blood cells are the army that helps protect you against infection. Okay? All right. And so that's why we would incorporate that into regimens. And we only do it in those regimens where we are really concerned that there is a risk of your white blood cells going low. Okay?
Okay.
So now that the numbers seem to be increasing, are you doing anything differently in your practice, or is your hospital preparing in a different way? I mean, we know more now than we did in March, right? But we're just kind of curious to know how you're preparing.
Sure. So, you know, really, we've held on to some of the changes that we've had since about March. You know, we are still trying to limit how many people come into the clinic, and we're still trying to socially distance as much as we can. And in our clinic, one of the things that, you know, for me is incredibly difficult, but something that we're doing to try to keep people safe. We're still only allowing, you know, one person in the clinic. So, you know, we have been very creative. At least I've tried to be very creative in the ways that I have family members involved. I've gone out to the parking lot to talk to people. I will sometimes incorporate telemedicine to do family conferences, because then I can have family members from all across the country involved in a video conference, just like we're doing right now. And we can talk, and and actually there I do a better job of sharing my screen than I actually did today so that you can actually see what's going on. you know, one of the things that's different, I think for me, between March and now, is that I am less afraid to give treatment and to give treatment on time. Okay, because in March, we really didn't know. We were changing, you know, the usual order of things. So if, you know, if sometimes, you know, when normally we may give chemotherapy or endocrine therapy after surgery, surgeries were delayed. So, you know, we were switching the order. We were giving chemotherapy before the surgery. And that's something that we call neoadjuvant. When we give treatment before surgery, that's called neoadjuvant. And so I was doing, we were, you know, changing things around a lot more. So I think now we're less afraid of treating people, you know, during the time of the pandemic, but we have not let our guard down.
Okay, so you're continuing with surgeries and treatment as if there was no pandemic, other than, you know, reducing the number of people who are entering the facility.
Exactly.
Okay.
Okay.
What about clinical trials? Can you talk a little bit about how clinical trials have been impacted and what is going to be, you know, the outcome of that impact?
That's a really great question. So during the pandemic, well, during, like, we're not, it's been going on so long, you know, at the very beginning of the pandemic, it was really hard. And for most clinical trials, a lot of clinical trial participation declined during this early time of COVID. And so what's happening now is that a lot of the research sponsors are doing exactly what I said we're doing in the clinic. We know that clinical trials must continue because we have made so much progress in breast cancer and in other cancers because of clinical trials and because of all the courageous men and women who volunteered of themselves for these clinical trials. So I am still encouraging my patients to participate in clinical trials. There's been less of an issue with enrolling in clinical trials now because, you know, a lot of the sponsors are more flexible and in understanding different things. And honestly, a nice thing that has happened as a part of the pandemic is telemedicine, right? And so, you know, more people are understanding that, you know, we can be a little bit creative in how we're getting things done, and we're trying to minimize some of the visits and extra screenings and things that may have not been as necessary. So, you know, we're really trying to be thoughtful and efficient. And I think that is a good change. And I can see that moving forward.
Yeah.
And that's a change that patients really have been calling for some time. Right?
Absolutely. Absolutely. I mean, you know, really, I am so humbled and honored when patients volunteer for clinical trials. I mean, because it really is a selfless act and you are helping so many people. And a lot of people don't realize is that every single chemotherapy, endocrine therapy, HER2 therapy, whatever therapy that I use, it's because of the brave men and women who participated in clinical trials before them. So really everything that we do, there's some data for it. And it's because of people who participated in clinical trials. And I can't stress the importance of that enough.
Do you think some of those changes will remain when?
I hope so. I really hope so, particularly telemedicine. I think that has been a nice change when it works, you know, and I think it's nice to have that if there are some people, you know, I'm in Florida. So I have a lot of people who, you know, maybe they're in a nursing home or an assisted living facility, or maybe it's a really struggle for them to get to the office. So this has been really nice for some patients. And I have some people who work, you know, you may not have to take off work, you know, to come see me. But of course, you know, we can't do that for everyone. but it's nice to have the option. So I think telemedicine will stay with us. I also hope, being efficient with clinical trials. I think that's a nice change, and people are understanding that, hey, you know what, we can change quickly, because in medicine sometimes it seems like to make changes we have to wait decades and decades and decades, but we can do things quickly, so and safely.
Right.
Okay. Well, there's been a lot of news this week about vaccines for COVID-19. Although the proposed vaccines are not injecting live virus into people, is it safe for people undergoing treatment to get a vaccine? And if not, what do you suggest?
Great question. That's a great question. And if I could pun a question, it would be that particular question. But so the very first thing I want to say is get a flu shot. If you have not gotten your flu shot, please, please, please get a flu shot. Now, as far as the vaccines, there's, especially this week, there's been a lot of, potentially exciting information that has come out about vaccines. And so I think, as soon as we get the data for it and we're able to review it and we have the safety information for it. So I've heard the press release. I have not read the data, but it does seem like it's exciting. And we do know that a vaccine will come. That's the nice thing. We know a vaccine is coming. There are several different vaccines that are available. I'm sorry, I'm just going to get a little bit of water.
Sure.
There are several different vaccines that are on the market. That will be on the market soon. So when a vaccine becomes available and it is deemed safe, then usually the way they will start is that it will go to vulnerable populations first. So we know that people who are at high risk for complications and healthcare workers. So we know that, there likely will be a prioritized list. I do think that once a vaccine has been deemed safe and is on the market, that I would recommend it. Having said that, the timing of treatment, I would talk with your provider about your specific situation and the best timing to get it. So yes, I would recommend a vaccine. The timing of which I would want you to really talk with your provider about when to get it. Okay?
Okay.
Good advice. And you mentioned that everyone should get a flu shot. Are all flu shots created equal? Like the one that we can get at CVS, is that equal to going to see one that we might get from our oncologist, for example?
Good question. So lots of good questions. I feel like I'm saying good question after every one. I need to stop saying that, but it doesn't mean that that's a bad question. So, there are different kinds of flu shots. So there is a flu shot for people who are 65 and older, and all of these flu shots are available in your oncologist clinic. So your oncology team will determine which flu shot is best for you. But in general, most places from CVS to here in Florida, there's a Publix on every corner, to Publix, to your oncology clinic, they will provide the flu shot that's best for you based on your particular situation.
Because COVID is obviously attacking the lungs in a severe way, do you also recommend the pneumonia vaccine?
Yes. So if you meet criteria for the pneumonia vaccine, I would recommend that you get it because we really want to try to protect your lungs as much as possible. And you do not want to have a pneumonia, have a weakened immune system, and develop COVID. Anything to try to negate the risk of a severe COVID complication, we would recommend. So I am recommending flu shots and pneumonia shots for people who would be eligible for pneumonia shots. Absolutely.
Okay.
Someone is asking about male breast cancer patients and how they might be dealing with diagnosis and treatment during COVID. Any difference between male and female patients?
Another good question. I promised myself I wouldn't say good questions to the next one. So, one of the reasons for that question is that, there has been data that men may have a higher risk of COVID complications. Whether that's due to some other things that aren't necessarily biological, I don't know that we have all of that information. So really, I would not treat a male breast cancer patient any differently than a female breast cancer patient. I would still want you to take the exact same precautions, because really, if we're taking the exact same precautions and your risk status, to me, whether or not you have a cancer or not, you still have to take COVID very seriously and really try to wear a mask, stay 6 feet apart, limit your social contacts, wash your hands, try not to touch your face, do all those things. And so I think I may have mentioned this a little bit earlier, but if not, if you are taking endocrine therapy, those are things like tamoxifen or an aromatase inhibitor like anastrozole or letrozole. Those are thought to not have as high a risk for severe COVID complications as some of the chemotherapies that we give.
Okay.
So it seems like, each state is responding differently to COVID, right? And something just came across my phone that Oregon is issuing the strictest US virus measures of the fall, placing the state in a partial lockdown for 2 weeks.
Wow.
To combat a surge
Wow.
in cases. Yeah, and it seems like, on social media, we've been seeing a lot about, the holidays are coming up. People want to get together with their friends and family, and to really, really limit that. But people are feeling so isolated, right? And especially if you're going through cancer treatment now, how isolating that can be. How do you deal with your patients around like psychosocial issues or anxiety, depression? Can you talk about that?
Cancer, I tell my patients all the time, I hate cancer because cancer tries to take so much from you. Mm-hmm. And in 2020 with cancer combined with COVID, it has been horrific. It really has. The social isolation, the economic issues that we've had have really been devastating. They really have. And I mean, there is no better word to use than absolutely devastating. And it's not fair, right? It's not fair to have this disease and to deal with it in the midst of a pandemic. One of the things that I say is that you are absolutely not alone. The depression is real. The loneliness is real. The anxiety is real. And it is something that we try to work through together. Because, I can't say that there are easy answers, that with cancer, I can say, you know what, I'm going to treat you. I can give you hard and fast numbers. I can say, this is when we start. This may be what to expect next. And with this, there are lots of unknowns, and some of the responses, we just don't know how long COVID will last. And we know that it's going to be here with us for a longer period of time. So Some of the strategies that I try to incorporate with my patients is to make sure that there is someone, I call it a cancer companion, someone who is walking this journey with you. And I know that there are some people who may not want a crowd of people to know what's going on, but I don't like it when you are dealing with this alone. So we try our very best to connect and to inform and to communicate. But if you are struggling and you feel like you need help during this very, very difficult time, I really want you to reach out to your healthcare team because they understand exactly what's happening with you health-wise and can get you connected with some of the people that may be able to help if you need more help. And another thing that I've actually liked as a result of the pandemic has to do with mental health and some therapy that's now available online. That's really been nice. You don't have to go to an appointment, and we can find people online to help. But I really can't think of a person that I've treated who, or not just me, a person that's dealing with cancer during this pandemic that has had an easy road. And so you are absolutely not alone.
Yeah, thank you for saying that. And, you know, Dale right here is our breast cancer helpline manager. Mm-hmm. And Share has other helplines as well for other cancers. So we have a breast cancer helpline, we have a metastatic breast cancer helpline, an ovarian helpline, and a uterine endometrial cancer helpline. And I see some of our colleagues are on today as well. And they provide services and support for Spanish speakers. Mm-hmm. So anyone can call the helpline and speak to someone else who has had a cancer diagnosis. And that person can walk with you, as you said, you know, side by side on this journey. Dale can talk about this some more, but, you know, we can call you every week. We can call you every other day. You could talk to a bunch of different people, join support groups. You know, there's so many options for people to connect, and we hope that, you know, people do reach out and connect, and they can always call our toll-free number, which is 844-ASK-SHARE, and get connected directly to someone who has had a cancer diagnosis or currently living with the disease.
And I can't stress the importance of this enough. I mean, it is so important to know that there are people who understand. There are people who understand. So please reach out if you need someone to talk to.
I've definitely seen an uptick in the calls that we're getting. Mm-hmm. People who just want to know somebody else is out there because they are feeling that isolation. And we certainly have been in their shoes, and we're living in the pandemic, so we certainly can relate to their issues, and we're happy to talk with them. And we can also, we have a great peer support where we can actually match somebody to a peer who's really been through a very similar journey. So that is available as well.
And thank you all so much for the support you provide. I mean, there's a community of people who care about you. There really is a community.
That's great to hear.
You know, I think for all of SHARE, we have about 200 volunteers. So 200 people that have had a cancer diagnosis, whether it's breast cancer, ovarian cancer, or uterine cancer, who, you know, want to give back and want to help because they either received help when they were going through it or they didn't, and want to be that help now. And so, yes, please call us, join one of our support groups, join an educational program. All of our services are free, and we're here for you.
And one of the, I could say, silver lining of COVID, if there is one, is that typically we have support groups and they're located more in the New York, New Jersey area. But right now during COVID, everything is being held through Zoom or telephone. So anybody anywhere is welcome to join a support group, and they can call our helpline to be guided to the ones that are available, or they can check out all of the available groups on our website.
Good point. Good point, Dale. And let's see. Someone is asking if you're able to provide services for Spanish speakers. Like, do you have maybe a Spanish speaking patient navigator or support group in Spanish for your patients in Florida? We do provide some groups in Orlando, if that's ever helpful to you. And everything now is online and easily accessible for people anywhere. But
right. Yeah. And honestly, I mean, in Florida, there's a large Spanish speaking population, and actually my Spanish has improved. It was muy mal when I moved down here. And so it's incredibly important to have someone that you can communicate with and that you feel comfortable with. Actually, one of the reasons why we started, the podcast that we started was really because we wanted people to feel comfortable and to feel like maybe there was someone who understands some of the unique things about me. And so it's incredibly important to have this. And like Dale said, the resources are absolutely there. So just let us know what you need, and we want to try to help you.
Yeah, go ahead.
I was going to change the topic a little bit. I wanted to hear some more about your colleagues on the podcast. But Dale, if you have a COVID-related question.
No, I was just going to touch real quickly on insurance for those who are not insured. I'm almost positive that if you go to like a CVS or a local drugstore, that you do get the flu shot at no cost. But what about the pneumonia shot? And have you heard anything definitive for the COVID vaccines, which I believe I've heard will be free to everyone?
I agree with you. I believe the COVID vaccines, from what I've heard, will be covered through your insurance company. If you don't have insurance, it's actually in the country's best interest for you to be vaccinated. So I would hang tight on that, because I'm sure there is a way that we would be able to get you a vaccine. And also to the people who aren't insured, I've seen it, and my colleagues have seen it over and over. There are people who are afraid to get the appropriate medical care because they don't have insurance, and the delay impacts potentially your outcome. And so one of the things that I really want you to do, I don't want you to delay your care. Every single cancer center has a financial counselor, a financial coordinator. There are also all of these wonderful, wonderful organizations. And I have seen our financial counselors literally bend over and pull resources from out of a rock to help people. So please don't let a lack of insurance delay your care. Talk to someone. Let's see what kinds of things can be done so that you can get the treatment that you need and that you deserve. Okay, you deserve to be treated. Okay.
That's an important message. That is an important message. Thank you.
We do offer resources if you call the helpline. We have state-by-state resources as well as national organizations that we can share with you.
And I think, Christine, one of the things that you said was about my colleagues with 3 Black Docs. So we have a podcast, Facebook. We're also on Facebook and on Twitter and on Instagram at 3 Black Docs. But really, Tiffany Avery and Karen Wingfield and I have been friends for years. And we're all oncologists, and we're all very passionate about helping others. And we all come about it at different angles. And so for years, for a long time, we've been having conversations, and we have passionate conversations. And so one day, Dr. Tiffany Avery decided that, you know what? I bet someone would be interested in hearing us talk, because we're saying so much information that may be helpful. And so we started recording our conversations, and that started 3 Black Docs. But really the goal is to educate the community. I think sometimes there is a disconnect between the white coat and the patient chair. And so what our goal is to eliminate that disconnect. We want you to know how to advocate for yourself. We want you to know resources that are available. We want you to be informed, because when you're informed, you feel less afraid. Okay. So, and I'm really grateful to Share for inviting me. I'm thankful for all the things that you do for our patients.
Well, thank you. And thank you for the work that you do, and for the extra work of the podcast, because I have listened to it a couple of times. It is interesting. It's funny. It's passionate. And it's really informative as well. So thank you for that. We'll give people just last opportunity to ask any more questions.
Let's see if we can.
And the other doctors and yourself, where'd you meet?
We actually met in North Carolina. So when I was working, we actually all worked in North Carolina, and believe it or not, I actually interviewed Dr. Karen Wingfield for her job in North Carolina. And I remember the night before I was preparing for the interview, and I looked her up and I said, oh my gosh, she is so amazing. How am I going to interview her? And so as soon as she came in the room, within 1 minute we were laughing, and I knew that she really is a rock star in oncology. And Dr. Avery and I met her when she came for an interview, and I found out she was from Louisiana. Mm-hmm. And actually during the interview, I took her around and started walking with her, because we just hit it off. And so we've really become lifelong friends. So it's really been nice to have them during the pandemic. Actually, we even need support during the pandemic. So it's been nice having our conversations. And a new podcast drops every Tuesday. So yeah, we'd love for you to join us. And we have a live podcast on Facebook once a month.
Oh, that's so it's 3 Black Docs separate, or 3 Black Docs all together? How can
three Black Docs all together on and the number 3 on Facebook, Twitter, and Instagram. And for the podcast, we're 3 Black Docs at simplecast.com.
Cast. Good. I put it in the chat for everyone that's participating today. So Dale, do you see any other questions?
We just sort of had some general questions about, what have you learned over all of these months with COVID? Because when we first started out, I know people had said, you have to watch like deliveries that you get from, packages from Amazon, and,
right.
You have to like scrub your fruit with disinfectant in order to not be exposed. Has any of that changed? And especially now that it's on the increase again.
A good question. So one of the slides that I had actually, and I got stuck on, it was from the Texas Medical Board, and it showed, a risk 1 to 10 of some of the things that we do every day and the risk of getting COVID.
Oh, okay.
And so it's a really nice chart. I'll have to get it to you. So, when everything first started, I think everyone wanted to live, sleep, and breathe in a hazmat suit. I can't say that I don't want to do that right now, but I am, I will go and check the mail. But really, honestly, every time I leave the house and come back in, I wash my hands still. So frequent hand washing is absolutely a must. I still wash my fruit vigorously. But as far as the risk of actually getting COVID from these activities, it's incredibly low. Your big risk are when you are in crowded places with lots of people, when there is singing, shouting. That's really where your big risks are. The bars, if you're going to a worship service, and there are 500 or more people there. Especially if you're unmasked, really no one should be around outside in a crowd without a mask. And really, you want to wear a mask. You still also want to be socially distant as much as you can. So don't let the mask make you think that you can't. You still have to wash your hands, still need to be socially distant. And one of the things about the mask, I know I'm talking to probably an audience that knows all this, but just in case you don't, if you have just one of the masks that you normally see, the surgical mask, you want to try to get a mask that has a nose wire in it so that you can clip that nose wire over your nose. And if you're like me and wear glasses, that stops your glasses from fogging up. But you really want to make sure that the mask covers your nose and covers your mouth.
Yeah, we see a lot of interesting ways that people wear masks.
I've
under their nose.
Yeah.
Under the chin. Yeah.
And also, I've also seen some very nice creative ways for people. So I have patients that wear hearing aids. And so sometimes it's really uncomfortable, or they've lost their hearing aids trying to take the mask off from over their ear. And you can get like those things that you have for sunglasses, and you can, put the mask, use that little wire to connect that way. So there are some creative ways that you can wear your mask and make it work for you.
Mm-hmm. Thank you for that.
Yes.
Any more questions?
Don't see any other questions. Dale, do you?
No, I do not.
Dr. Lamar, you have been absolutely fantastic. We can't thank you enough for being with us today.
Well, we recommend the podcast to everyone.
Well, thank you so much. And honestly, it's an honor to be here. And to everyone that's listening, I say this, but I will repeat it. Remember, you may have cancer, but cancer does not have you. And, I want you to, keep being resilient, because if you're listening, that's exactly what you are. You are resilient. You want to be informed. So keep up all the good work that you're doing. And I look forward to the future when all of this is behind us with COVID. So thank you so much for having me, and I'm so honored. So thank you all. I hope you all have a great weekend.
You too. Thank you so much. You are awesome. We will listen to your podcast, and we hope to see you again sometime soon. Take care. Thanks everyone for participating. Thanks for your questions. Have a great weekend. Be safe.
All right. Bye.
Thank you.
Bye.